And on we go to 4.4. We're looking at some skin pathologies in this video. We'll look at the causes of some common skin diseases. We'll also consider a disease that really isn't one, and you'll see what I mean when we get there. We'll also look at some age-related issues with the integumentary system and conclude with looking at some of the healthcare considerations. What should you be looking for if you're doing a physical assessment? What changes are you expecting to see in someone as they age with regards to integumentary system? So we'll look at some of those things in this video. Let's start with some common skin pathologies, and um, I list these here just not because they're special, or not because they are anything unique. It's just I wanted you to see some examples of some, and I try to put 4 on here that are maybe a little more misunderstood than some of the other ones. Let's start with this one. Let's start talking about skin tags. And you see the term there, acrocordon, or fibroepithelial polyp. This all refers to the same thing. These are not warts. Okay? These are benign growths. They're going to be extra growths, extra associated with extra rubbing of the skin in that location. Usually you see these where people have skin rubbing on skin. For example, someone who's obese and they have extra skin, folds of skin rubbing on one another can sometimes find skin tags developing. Women who have larger breasts, for example, may find that they will develop acrocordons on the inferior side of the breast where the skin is rubbing on the skin of the abdomen. So these are, again, extra growths. They are benign. They're not harmful. They're not precancerous. And again, they're not warts because warts are associated with a viral cause, and these are clearly not viral. Next, let's look at ringworm. People may associate just by the term that ringworm is caused by a worm. Actually, ringworm is caused by a fungus that has gotten in the skin, and it grows in a circular pattern, therefore giving it that round appearance. This is a very contagious skin disease. Any contact with it, any contact with clothing or items that have touched this can pass the fungus, the elements of the fungus from one person to another. It's very treatable, but very contagious. And just one more slam against smokers, I guess. Heavy smokers are more prone to this, perhaps because, again, a compromise of their immune system, and they just can't fight off the ringworm if they are actually exposed to it. Eczema, over here, also the term you'll see for this is atopic dermatitis, and that means an inflammation of the epidermis. This term is broadly applied. Many people call it eczema, but there's actually multiple types of this inflammation in the epidermis. It can be caused by a combination of environmental factors. Maybe there's some genetic risk factors. They may run in certain families where many family members have a form of eczema. There is no cure, but there are treatments to reduce the inflammation. They may be taking forms of steroids, for example, to reduce the inflammation. Many times the bad part of eczema, if you will, is the inflammation response that accompanies the after effect of the outbreak of the disease. So steroids can sometimes be used to manage eczema. And then acne. Acne vulgaris, as you see here, affects mostly the skin associated with sebaceous glands. So we're going to see someone develop acne on their face, on the upper chest, on their back, and what causes it is actually an increase in testosterone. And you're thinking, wait a minute, I was a female and I had acne. Both genders actually slightly increase, well, males more increase, obviously, but even females will slightly increase testosterone levels at puberty. And this actually results in some hyperkeratinization, some blockage of the pores, as well as an increase in sebum production. So you're making more oils, but more of the follicles are blocked. So that actually leads to this inflammation reaction that we associate with acne. Most of the effects of acne are psychological, I suppose. while you have acne as a teenager, but you can have some permanent scarring if you have acne for a long time, especially if it's quite severe. It can result in some damage to the dermis and can result in some scarring. I just want to show you some other examples of integumentary diseases. We won't discuss these in any detail because there's quite a few of them here. And I'll show you one example of psoriasis, which is a disease that we associate with really more of the immune system. It sort of plays out, if you will, on the skin, but it's actually an immune system related disease that causes these skin lesions and scaly patches, and it's very itchy. And relatively common. About 2 to 3%, maybe even 4% of the people have one of the forms of psoriasis. So since it's not purely a skin disease, it can affect other systems too, and there's no cure. I show you this as just one example because when you look at the list here of other skin disorders, measles, German measles, chickenpox, scabies, leprosy, some of these can have multiple effects on the body. So don't assume that if someone has just leprosy, for example, or just chickenpox, that the effects will be confined only to the integumentary system. And in fact, there may be complications because of that skin disorder. Let me show you one disease that's not technically a disease, cellulite. It really isn't a disease. It's actually a term invented by marketers many years back, and it's just fat. It's the same as any other kind of fat that we store in our subcutaneous layers, and it's sort of made worse because the fat can kind of push its way into the dermal regions, giving that dimpling appearance. Superficial fat cells in the hypodermis are actually a little bit different in males and females. And I guess I'll try to draw this kind of quickly here. If you imagine that we have 3 fat cells in males and 3 fat cells in females, I'll do it like this. Okay, so this is male and this is female. What tends to happen because of hormones is males will kind of put their fat in their fat cells more or less evenly. Females, just because of their hormones and how they deposit fat, may actually put their fat in their fat cells unevenly. So the net effect is to have sort of this dimple effect where a male is going to have more or less a straight line effect. So this happens in 80 to 90% of post-pubertal females. It rarely happens in males unless they have hormonal abnormalities, which is why then we associate this far more with females than males. Come back here. It looks wrinkled because the collagen fibers that are in the dermis are kind of trapping it down, kind of like a cargo net, and so you can put all the cream you want to on the epidermis. It's really not getting to the collagen. It's really not causing any effect. And in actuality, according to this professor at the medical school, there really is no cure for it. The only cure, I suppose, and it's not very glamorous cure, is simply to not have as much fat in there, and that is going to be caused by long-term metabolic changes. But if you want to remove it, there is a procedure, of course. I'll just show you this one rather quickly. Liposuction is where they actually insert this cannula in there, and they actually suck out the fat. It's one of the more common plastic surgeries, and there are some possible complications and side effects. If you want to, you can watch the YouTube video that actually have linked it here. I'll try to post a link if I can, where you'll see how this procedure is done. However, it does not significantly improve metabolic abnormalities that got someone fat in the first place. So if you want to remove, excuse me, if you want to remove extra fat that you associate with cellulite or extra fat that you associate with obesity, there is a benefit to removing some fat. However, the reason that you got fat, or the reason that someone has extra fat tissue, is not necessarily going to be cured by this. The fat that we associate more with cardiovascular issues long term is going to be visceral fat. That is fat between the organs, not this subcutaneous fat that you're removing in this procedure. Long way of saying this is purely a cosmetic, but not necessarily going to be a health benefit in terms of current research. I just want to mention some age-related changes we associate here with the integumentary system. As we age, these will probably be pretty obvious to you. The skin will become wrinkled because it's going to lose some resiliency. Some of those elastic and collagen fibers are simply not going to be regenerated at the same rate, and therefore there's going to be some wrinkled skin. The skin becomes thinner and drier and less elastic. Those elastic fibers are often going to be replaced with some collagen fibers, and so the skin is going to have less give to it. It might still be okay in its strength, but it's also going to have a loss of elasticity. The sebaceous and sweat gland activity also decrease. Capillary blood flow decreases, so someone who has a skin injury may find that it takes longer for that wound to heal. And the fingernails will usually thicken and become ridged and grow more slowly. If you've ever seen an elderly person's nails, they tend to look, kind of heavy, and they may have ridges or grooves in them, and are quite thick. Skin color can be useful for diagnosis, and I'll just point out some examples here. You can note here by the color of her lips that she is cyanotic. We have here phototherapy, and you can notice the yellow in the eyes here, associated here with the coloration of jaundice. Down here you see the coloration in the cheeks that we associate with a condition called erythemia, and down here you probably recognize that as liver spots, even though of course there's not a liver disease there. It's just long-term freckling effects that we associate with sun exposure. But there are more than 2,000 diseases or conditions or disorders that can change the color of the skin. So I point this out because as you're doing assessments of patients, pay attention to skin coloration differences, or where you notice that the skin is either darker or lighter or has a tint to it. Here's another example, Addison's disease. John F. Kennedy had this hormonal disorder that causes a bronzing of the skin. So even hormonal disorders may be diagnosed in part based upon skin color. I want to remind you of your important role in the process. As you move from patient to patient, you can transfer microbes from one person to another. Don't get me started on the importance of hand washing in healthcare, but this plate shows you the number of bacteria that grew when a nurse touched that plate after 24 hours, how many bacteria grew. You are carrying organisms from one patient to another if you are not careful. So that can be a whole another source of disease process, is if you're not careful about how you wash your hands. And finally, as you are looking at patients and paying attention to physical assessments, things that you can touch on that we've already mentioned in large part. This is just to sum things up here. Skin color, temperature, turgor, that is, does the skin feel warm? Does the skin feel cold? Does it have sort of a give to it? Is it flexible? Does the skin have an odor? Oftentimes, infection processes can cause the skin to have a different odor to it. Fungal diseases can sometimes give the skin an odor. Scars, masses, looking at fingernails and toenails, capillary refill. If you mash on someone's thumbnail or on their fingernail and the color comes back within a couple of seconds, that shows a very good capillary refill, meaning good circulation. If it's slower than that, it means often poor circulation. And again, paying attention to moles, as we discussed in the skin cancer discussion, you want to make sure that you're paying attention to changes in the moles. And if you see a mole that's somewhat suspicious on a patient, ask them about it. And they may say, well, the mole has always been that way, or they may say, well, actually, I've not noticed that. And if that's the case, that might be a very good argument to have that mole biopsy. Okay, that concludes 4.4. We will finish up with looking at burns and some other accessory parts of the integumentary system.